Singapore is ranked lowest, right, when it comes to penis size in the world.
Oh my god.
Yeah.
It is easier to increase the girth than it is to increase the length.
So the thickness.
Increase the girth.
How can someone actually last longer?
Actually, a very simple, non-surgical effect. You just
What the hell? Why do sperm taste differently based on your diet?
great question.
Is masturbation like good or bad?
Masturbation has been associated with
Cut that dick off.
Alright, ladies and gentlemen, today I'm very excited, not for myself, but because John Paul is finally going to get help in this department. It's going to be a fun episode. We're going to be quite literally talking cock. We've had him on before. He's a leading andrologist who has spent 30 years in medicine helping countless men penetrate deeper into the root cause of men's sexual health issues. So let's unzip taboos and give a massive welcome back to the show, Dr. Tan Kok Kwan. Welcome
Thank
back.
you, guys. Thank you. Thank you. It's great to be back.
So let's get
Crazy that your name has
the word cock in it.
Right? It's so appropriate.
That's crazy.
Yeah.
People bring it up,
Actually, no.
but you think about it.
Yeah. It's a calling, ma. My parents. Right from the start, my parents knew what I was going to get myself into.
Shit.
Actually, why did you choose this line? Like, doctor got so many directions to go.
So after graduation, we went through our usual rounds, Tandossing, SGH, moving from department to department, public sector, because we're all bonded. So finally it came out, still didn't know what to do, but figured that I want to kind of keep at the forefront of things, at the tip of things.
Nice, yeah, I see. Yeah.
At that time, HIV rapid saliva test was coming into Singapore. Right? So I think, oh, this is good. So I just use it. And also at the time, MOH was expanding its anonymous HIV testing sites. It so happened that I was getting quite a few HIV test cases. Then because we were doing a high volume of these HIV saliva tests, the distributor of the kits actually came to me and said, hey, do you want to apply to be an anonymous HIV testing site? I said, fine, I'll apply. Then, lo and behold, we got it. So then, obviously, the volume for HIV testing increased. It makes sense that it segue into STD screening and treatment also, because they're related, right? Also, then we were seeing more of the MSM population, men who have sex with men.
I see. Yep.
Right? So they'll come forward for this HIV screening. Again, then that naturally segues more into a men's health practice. So that was how I kind of went into this whole sector. Yeah.
Okay.
Yeah.
So when you were at the initial clinic with the HIV testing, it wasn't a men's health clinic?
No, it wasn't. It was a GP clinic.
I see. Okay, I know we've joked about it, like we've said things like penis doctor and whatnot, but clearly it's not all about that. What does an andrologist actually do, and what are some of the misconceptions that people have about the job?
We're basically a male gynae, right? So we'll look after, like we discussed, sexual health issues, ED, PE, infections, fertility issues, hormonal issues, right? The older men with testosterone deficiency, for example, right? We'll do circumcisions, we'll do vasectomies.
What's like the bread and butter? Like is it circumcisions, like the usual?
Circumcision is definitely one of the run-of-the-mill things we do. I would say the commonest thing we deal with is still infections.
Given that you've seen a lot of penises in your entire life, how many would you say?
On a daily or weekly or what?
A day, I guess 10?
Whoa! So you see, it's like almost, I would say, okay, like given that it's weekdays, like 2,000 dicks a year.
Fair? I not actually thought of it, man.
There were so many directions that we could have taken this interview, and I think the first thing, right, was really about addressing the metaphorical elephant in the room, which is that Singapore is ranked 10th lowest, right, when it comes to penis size in the world. There's like 100 over different countries, right, and it's like 90 something.
Oh my god.
Yeah, in terms of average penis length. So I think on behalf of all the Singaporean men out there, what are the medically official ways, right, you can actually enlarge a penis?
All right. So let's dive into this, like the holy grail of men's health.
Yes.
How to get us bigger.
Yeah.
Okay, so first
Why here?
basic concept. It is easier to increase the girth than it is to increase the length.
Okay, so the
To
thickness.
increase the girth.
That means the circumference is
The
easier.
circumference,
Okay.
yes.
Okay.
Wait,
Why?
So to increase the girth, the circumference, we basically just need to stuff something under the skin, right?
So
Right?
you're just putting more like fats.
More stuff. Fats is actually one way.
Okay.
So we can actually suck the fats out from usually the butt. You spin it down and then inject it under the skin.
So if we see that someone has no butt,
It doesn't take that much now.
But the weight imbalance, though,
Yeah,
they keep
whoa.
tipping forward.
yeah, that's what we try to achieve. Actually, what is more commonly injected is hyaluronic acid.
what?
So the same stuff that people inject to the face to
HA.
plump out. HA, we can inject HA under the skin in the penis to increase the girth.
It's the biggest thing now. All the cosmetic companies are saying hyaluronic acid.
Yeah, why waste it on the face, right?
No, but is it sustainable? Does it actually that size? Does it actually last?
No lah, HA is naturally absorbed by the body. Right?
So you have to keep injecting.
You gotta keep injecting every 12 to 18 months.
Okay, sorry. So to understand, right?
Yeah.
If I go and see you to get girth expansion or whatever this is, right?
Later today?
I cannot wait. Maybe lunch.
Is that medical? Is there a medical term for this?
Yeah, is there a medical term for this process?
HA filler injection.
Okay.
Yeah.
Okay.
Filler injection.
Oh, it's literally like fillers.
It's literally
just-
fillers.
It's the same thing.
It's the same thing.
So if I'm a long-term client of yours and I also wanted face fillers, you can help.
Can lah.
But dirty, yeah.
No, like, inject face first then.
Okay. No, so then how much additional girth is achievable?
Oh, that's a very good question.
really
That's a very
asking
good
for himself.
question. So increase in circumference, we try to achieve 1 to 2 centimeters. Circumference, not diameter.
Uh-huh.
Circumference.
Oh, okay.
No, but it adds
so
up.
like this become this by 1 to 2 cm.
Yeah,
Okay,
circumference.
Can achieve more?
Can, but then you end up using a lot of fillers. You need a exponentially increasing amount of fillers to increase the circumference. You see.
Okay.
Okay. And what are the potential like side effects or things to consider if you are thinking of getting this?
So very, very good question. So
That's great questions all around.
we always upplay the side effects and downplay the pros because we really want patients to make a very informed decision.
Yeah.
As with any injection, we are breaking the skin. So there's always a risk of bleeding. There's always a risk of wound infection. The nightmare scenario is if the filler blocks off a blood vessel. Then one patch of skin will actually die. So it's happened to face fillers before. Right?
Okay.
Yeah. So my patients should always be aware that these kind of things, there's always a risk.
Right.
Yeah, so always weigh up the pros and cons before deciding to undergo such a therapy.
How much
Which
actually?
is, I don't even know how much.
Yeah, so most people will charge around about 800 per mil of filler. So you're
Okay.
talking about a treatment that's a few thousand.
Yeah.
Mm.
Do you lose sensation when you are using it after you get the fillers? Because I'm thinking like, it's
Good question.
Which is just full of good questions.
hey man.
No, you actually don't. So where the filler goes is deep to the cutaneous nerves, you see. So the skin, the nerves to
what?
the skin is still active, still there, still alive, undamaged. So
Ah.
all the sensation is there.
Oh, okay.
But this is a great segue into the other point you asked about the head, right?
Yeah.
Because when we increase the girth of the shaft,
Yeah, but not
Right?
the head.
not the head. So if you increase the girth of the shaft greatly, right, it ends up looking very weird. Can you imagine this huge bulb and then you just put a little small mushroom on top?
Like American football.
It's like-
Yeah. Oh my
Yeah,
God,
like that.
Actually, like a puppy
Does it actually
head
end up looking like that?
No lah. I mean that is
Extreme case.
that is a mistake.
that would be a mistake.
But we do inject filler into the head, not so much to increase the size, but to desensitize the head.
Oh, why?
Wait, why?
Why? For premature ejaculation.
Oh.
So it's a different process.
So you can last longer.
Okay.
Okay.
So when you inject filler into the head, what you're doing is you're putting a gel in between the skin and the cutaneous nerves. So you desensitize the head.
So we've talked about extending the girth, but I think a lot of guys also are wondering, like, is there a way to extend the length? So there was a concept that someone brought up, something called more dick, which is obviously not the official
More
term.
dick.
But apparently, I don't know how true, there is a little bit extra dick, right, that guys have that is where it kind of connects itself to the pelvis. And when it erects, right, that's why it doesn't like fall off.
It's like construction mechanic, right? lah.
Yeah.
If
You
it's
need a
dangling on
fulcrum.
the edge, you will just break. But so it's here.
Yeah.
So it stays
So
sturdy.
you can extend like
So there's a dick bridge.
I love it. Yes, it's called the. No, seriously.
Oh, it's called
the
dick bri-
suspensory ligaments. No, it's not called dick bridge. no. Suspensory ligaments. There are two ligaments that hold on to the top of the penis so that when it erects, the ligaments pull and then it comes up.
oh, it is like
really
a bridge.
Yes. The problem with these ligaments is they pull it up, but they also pull it in, right?
Ah.
we can do a surgery to cut these two ligaments.
But it won't rise anymore.
Yes. So when it gets high, it points at your toes.
Oh, but you can ownself.
You use your hand or your partner nice enough, your partner can help you. Aside from cutting the suspensory ligaments, people with a very prominent pubic fat pad. So imagine you have 3 inches of fat, right? And then a flaccid penis is maybe 4 inches long.
It looks like a 1-inch penis.
Exactly, right? So for patients who are a little bit obese, overweight, we can get them to try to lose weight so that this fat pad goes down. Then you see more of the penis. Right? But some people, they're already slim, but we can do liposuction of this area.
Okay.
So that more of the penis is visible.
Oh, so you're not affecting the size of the penis. It's just the size of the
So it's what's visible, right? So actually a very simple, non-surgical visual effect people can achieve is you just go scorch earth
Just shave.
Just shave.
You shave, then everything looks bigger.
Yes.
Oh.
Yes.
Scorched.
Boom. Just get rid of the rainforest.
Yeah. Because it's a perception thing.
Yes.
You see a lot of rainforests every day.
Yeah.
Do you advise them can you please shave or
Before visiting.
or do you have to clip the hair?
Okay, so I don't advise my patients to shave for no reason. There's specific medical reasons to shave. For example, if they have lice.
Oh.
Oh shit.
For example, pre-surgery. Let's say without circumcision, I don't want to be stitching and trying to move hair out of the way. Right? There is another surgery there's this C-shaped plastic tube that we can slip under the skin of the penis, So it pushes the penis out. So it's not actually lengthening the penis, but it's like making the guy have a permanent semi-erection.
What are the side effects? What are the downsides? Or
As with every surgery, bleeding, wound infection, but the permanent side effect will be then the erect penis will not point straight or point up. It will always point down. One more. So there's this surgical procedure called a 3-piece penile implant. It's actually 2 plastic tubes that you insert into the penis. It's connected to a reservoir of fluid, usually salt saline, and then a pump that is in the scrotum. So you feel like there's a third ball, but you grab it and then you pump, and then the fellow will just...
Wait, you pump yourself?
Your partner can pump for you.
Wait, but...
manually?
Manually.
Or it's outside your body, the pump?
No, it's inside. So you feel like you have 3 balls, but one of them is the pump.
Well, you squeeze the wrong one.
The texture is quite different.
Oh, so you're
You're like in it, Or like your partner don't know.
After you're done, there's a valve next to the pump, which you can release and then it comes down.
Oh, like the air.
So just deflates.
We usually use this for people with very severe erectile dysfunction, where everything else doesn't work.
Okay.
But because this plastic tube is in the penis, it also lengthens the penis. It's like a permanent semi.
Like these surgeries, right? Most of the time, like the clients that come in, they're asking to get these procedures done because insecurity of size or actual performance and like bait with their relationships and all that kind of stuff.
Again, another good question.
Goddamn.
I came prepared.
Generally, if they're doing it for a partner, they're doing it to save a relationship, we really dissuade that. Right? But if they're doing it for themselves, to make themselves feel better, then I think it's great.
So what's the minimum length you need to be able to get these things? Because I'm assuming there is like a penis too small to be held. Like micropenises, for example, or actually can all be held.
The medical definition of micropenis, that means there's a pathology behind it.
Okay.
There's some hormonal issue or some genetic issue. So that one has to be fixed separately.
I see. So in childhood already, the pediatrician will know like this looks like it might be a micropenis situation.
Yes, because sometimes when child is born, they have ambiguous genitalia, right?
Okay.
It kind of looks like a big clitoris or small penis, and then you can't suspect that there's some genetic issue going on already.
Understand.
Some people have normal penises but complain they're small. That's by definition, that's not micropenis. That's a misnomer, it's wrong use of the term.
So what's normal?
Okay, so how we measure penises in medicine is we do what's known as the stretch penile length. So number 1, you need to measure it from the pubic bone. Number 2, you have to stretch the penis. You can't just leave it flaccid. Yeah, because different environmental conditions, the length will be different.
It's stretched different from fully erect?
The stretch is different from fully erect.
Okay.
Fully erect will be longer.
Oh.
Yeah.
Okay.
Yeah. So stretch penile length, anything more than 8 cm is okay.
No, but like what's the difference? Because there are growers, there are showers. There's like, okay, you stretch from when flaccid, but then you might not be able to grow after that.
Exactly why we do stretch penile length, because there are growers and there are showers.
Why are there growers and showers?
Wow, like that. So the erectile tissue, the sponge that fills up with blood to make the erection, right, is a live tissue.
Okay.
Right? So it's it can relax to fill up blood, it can contract. Right? It's not just a dead sponge. Muscles that control the blood vessels sponge within the penis is more relaxed. Day-to-day basis, it's kind of filled more with blood, so it hangs out more.
Yeah, so something like an analogy that someone brought up was that I think a lot of us think of it as a muscle, but we should think of it as a sponge.
It's a sponge, yes.
Yeah, the penis. Just round off this conversation as well. In your opinion, do you think women actually get more satisfied by size, or actually size doesn't matter?
Great question.
Hey, finally.
I honestly am not aware of any studies on that.
To confirm, not deny that lie, essentially.
Yes.
Speaking of going the other way, are there cases where penises are too big and they come for penis reduction?
No.
I was going to ask the real question.
I have never seen that. I have never seen that.
So it goes to show that if people are getting their penises bigger, but no one is getting a penis reduction, I guess women do want bigger penis. Before we move on from this, I just gotten a word from our producer who really wants to know about this because he's asking for himself. Jelqing, I just want to press you on this. Are you aware of jelqing and does it really work?
What is that? What is that?
So there's two things. So jelqing is an exercise, it's a stretching motion that you can do regularly that will help to increase it. Pumps, on the other hand, is like a vacuum. So what happens is that it kind of vacuums, or like it creates a vacuum for the blood, right, to enlarge the penis temporarily, and then you quickly put a ring at the base so that the blood stays there, and then you penetrate.
Okay, I'm going to talk about these two things separately. So the first one, stretching. Not only physically stretching, people actually sell devices, these plastic devices that you clip the head of the penis, and then there are two rods by the side that butt against the bone, and then it pushes the penis forward. And then as it stretches, you're supposed to be able to add more length to the rod so that it gets longer and longer and longer. Okay? Yeah. I would advise against that.
Okay. Yeah, fair enough.
Sounds like
Yeah.
Okay. Yeah, hey, young, don't
It's like the torture device, you know.
Yeah.
Then you crank it.
Yeah, it does sound like a torture device.
That's what I imagine.
And when it comes to vacuum pumps?
Okay, vacuum pumps, you have to differentiate between a vacuum erection device and a vacuum therapy device. What you were talking about just now was called a vacuum erection device.
Yes.
Right? That means you vacuum pump, the vacuum draws blood into the penis, and then you snap a tight rubber band at the bottom so blood cannot go out. That is good for people with very severe erectile dysfunction.
Right.
The problem with that is they must remember to remove the rubber band after half an hour max.
Because if not, the penis will fall off.
I mean, there's no fresh blood flow lah.
Oh.
Now, vacuum therapy devices do the same thing except no rubber band. So it stretches out the penis and then you relax it again, stretches out again. It's like physiotherapy for the penis. Right?
Okay.
So this one is particularly good for patients after a prostate surgery. Sometimes there's cancer. Then we had to cut out the whole gland, right?
Yeah.
Then scar tissue forms. Then it pulls the penis into the body. So it shortens it.
Okay.
Right? So if you use a vacuum therapy device post-prosthetic surgery, it can help to maintain the length.
Okay.
Right? So it's not actually lengthening the penis.
Oh.
It is coming back to normalcy,
Yes,
essentially.
correct.
Okay, to its default. Okay. So I want to bring up some quick fire stupid questions, if you don't mind lioning some of that.
Okay.
Why does the penis shrink when we go swimming or when it's super cold?
Why do your fingertips get cold in the cold weather? Because the blood flow cuts off, your body's trying to conserve heat.
I see.
Right? All the blood vessels close up,
Okay.
Penis is made of a lot of blood vessels, Yeah. It will the smooth muscle around the blood vessels will contract.
Interesting.
Yeah.
Okay. How droopy is too droopy for balls?
I don't think there's such a thing. There are certain pathologies that will make the scrotum very, very big. So like a hernia.
Right.
Right? So the intestines or the fat from the tummy spills out into the scrotum. That will be very big. Right? Yeah, like what we call a hydrocele. That means there's a bag of fluid inside the scrotum. Or a varicocele. That means the blood vessels within the scrotum get enlarged.
Yeah.
So these are problems.
Okay.
Right? So I wouldn't say it will hang lower, but it'll definitely look bigger.
So it might be a symptom of a bigger problem. If that's the case, then you should go and see a doctor.
Correct.
Okay.
Wait, how close is the balls to your butt?
What?
As in, like, as in,
Like
like,
a 5-year-old.
I can't imagine. Like, why does it go low?
Why the testes hang outside the body is because for proper sperm production, it needs to be about 2 degrees cooler than core body temperature.
Oh,
Yeah.
what the hell?
Okay.
Yeah, that's exactly why it hangs out the body.
That's crazy.
So our body would pull the testes nearer the body to warm it up if the weather is too cold, and then relax it out to cool it down if the weather is too warm. That's the normal mechanism.
Right, okay.
That's why we tell guys not to wear too tight underwear, because then it doesn't allow the testes to cool when it needs to cool.
So I've been wearing boxers my whole life. That works.
Yeah.
Yes.
So if a guy sits on a very hot metal chair, what happens?
I don't know about metal chairs, but we do know that guys who go to like onsen or saunas very
Okay.
often, the sperm count does drop.
Oh.
So if you're trying to get a kid, you would suggest not to go onsen.
No, definitely not.
Oh,
Yeah.
that,
Oh.
it
No, I
actually
think not enough
affects-
people know this.
Yeah, that's
Really?
crazy.
Yeah.
Oh, no, temperature is a big thing, man. It's
So
a
like
big, big
sauna
thing.
also, you would say bad idea.
Bad idea.
Oh.
Yeah.
How about an ice bath?
That one I don't know.
Oh. I would
Because
think
it's
like cold
hot
then.
and
Yeah.
cold, right?
Sperms all like
Where
Like, whoa.
No, like contrast therapy, you have to like.
I don't know if it helps. Right. Yeah.
Why does it require so much concentration to pee after sex for guys?
Your semen is stored within these structures behind the bladder, seminal vesicles, prostate, right? So how do you shoot this semen out? The
Okay.
muscles around it contract, right?
Oh.
So it squeezes it, squeezing a bag, then things shoot out, right?
Ah.
So it takes a while for the muscle to relax so that things can come out from the bladder. That's number one. Number two, there's still semen within the urethral tube.
Yeah, okay, so it's blocking the pathway.
It's blocking the
essentially.
pathway. And it takes a while for the semen to liquefy, right?
Okay,
Is there such thing as like leaky passages?
Leaky.
Meaning like the
passages.
sperm is always like flowing out through like out of that tube.
Oh, it's like pre-coming all the
Like
all
it's
the,
an issue lah.
Oh, it's
like
leaking?
unconsciously,
Oh,
like it just like start coming out. Then you like, hey,
But pre-cum tends to be like a bit more transparent rather than white, right? Compared to like actual cum. Or is it just a perception thing on the...
I don't think
It's
there's a
just
study
you.
on that.
How you know of this?
I'm revealing too much.
So when we were doing the pre-prod for this episode, right? He said something that shocked me, okay? And I need to ask you about this since we're on the topic of sperm now. He basically said that the consistency of his sperms at times,
Hey,
Oh,
no, I'm
yeah,
saying
yeah.
of guys in general.
okay, of guys in general, it can be chunky. Is that real?
Yeah, I can.
Gelatin lah. Like,
Yeah,
it looks,
yeah, yeah.
gelatinous.
Yeah. So when semen first comes out, it's supposed to be gelatinous.
There we go.
Yeah.
Okay.
Yeah, but not chunks lah, bro.
No, like chunky bits.
Huh?
Hey, you shouldn't laugh. You should be concerned if a doctor goes,
So it's not normal for it to have bits.
It can have bits.
We can
You can have
have
bits.
What is this bits?
Protein.
Oh, so I'm just releasing a lot of protein. Okay.
What proteins?
Yeah. And it's supposed to liquefy.
So I just didn't give enough
Like
time.
ice.
If it takes longer to liquefy, that means it's probably some inflammation going on. There are a lot of chemicals in it preventing it from liquefying.
Does it have to do with my hydration levels?
No, nothing to do with pineapple juice either.
Is it healthier if your sperm is like thicker?
In terms of fertility, right?
Mm.
No, it doesn't matter. Semen, most of it, more than 90% of it is not sperm, right? It's the liquid that the sperm needs to be in to survive.
Okay.
The actual volume of sperm is very little.
You brought up pineapple juice. Why do sperm taste differently based on your diet?
I don't know. I honestly think that that's a bit of urban legend.
Oh, so you say it's not true?
Yeah.
Oh.
Yeah.
Or do you think certain food, right, when you eat it, helps the body produce more sperm?
Oh, that
Like
is a good
eels.
question. Certain micronutrients have been shown to help sperm production,
Okay.
Okay.
like zinc, like carnitine, like CoQ10. So you actually see a lot of these fertility supplements for men out there that contain all these things.
Mm.
Okay.
Yeah. So not particular foods, but micronutrients.
I wanted to ask, right? Like in school when the doctors check your balls and then they just like they do this, right?
Yeah, or like NS also.
What is that?
I can't say I've ever worked in school health service, so I really don't know.
Right.
But I do know that when we are asked to turn aside and cough and the doctor press, right, they're searching for hernias.
Oh, because sometimes they like cup your balls. Like when you go NS, for example, a lot of guys say like, oh, the doctor will like cup your balls.
Uh-huh.
That's for hernia, or like they're finding something weird in like the ball sack?
I would assume it's for hernia because hernias, when they come out, what they do is they slip into the scrotum. Yeah, I would assume that.
Because I think like Alison was saying that she was asking whether it's to check for like a third testicle or something like that.
No, I was saying
But close enough lah.
I thought they were double confirm whether you're a boy. Like what if a Mulan situation? So they just confirm like, okay guys.
School as a boy.
I think one look, it should be obvious lah. Shouldn't have to.
You mentioned before on the topic of ED that like we should caution from immediately linking it to mental health or psychological issues. But there is a connection. What tends to be the case? Because like I read online, like it could be porn addiction, it could be masturbation. Like, what is the connection between mental health and ED?
Porn-induced ED, definitely. The theory is the patients get so used to a particular type of stimuli, usually rather extreme lah, right? That when they get normal stimuli, they just don't get that stimulation for erection lah.
Normal being like a naked partner in front of you.
Right. Yeah.
Okay,
right.
okay.
As opposed to the unrealistic extreme situations in porn lah.
There's something that we learned from we had a sex consultant on, and it was something called the death grip or the iron grip. So like guys get so used to masturbating themselves that the speed in which they masturbate or like the squeezing, like the tightness, right? When they actually get into like a real vagina, it's just not realistic in that sense, and so they can't like hold an erection.
Yes, so it could be visual, it could be auditory, it could be tactile.
So then they might need to, while having sex with their partner, watch porn at the same time.
I actually had a patient who came in with his partner and she was pissed off because that was exactly what he was doing.
Oh.
Without her knowing?
No, with her knowing.
But that's the only way that you could get hard.
That was, yes.
So then
yes.
how do you fix that essentially, or like help to mitigate that?
I will refer them to a counselor.
You need psychological help rather than physical.
Correct. Yeah.
Okay.
Yeah, it's not a physical issue.
I was reading something online which was very interesting to me because I always thought that they were very connected, almost interchangeable, which is a guy said that when he gets aroused, he can get an erection easily. The problem is that he can't get aroused. How are they different?
This is a very complex field. As doctors, we first look for physiological reasons why he cannot be aroused, mostly hormonal.
Okay.
Right? And general health. Right. So if you think of an extreme example, if a person has kidney failure, very hard to get arousal, right? So general health problems and hormonal problems. So if the testosterone is very low or the estrogen is very high or the prolactin is very high, that can affect arousal. Then if it's not a physiological problem, again, it moves into the mental health realm, right? So now there are all sorts of these terms like asexual and yeah, so that one again will prefer them to the appropriate professionals.
Okay.
Right,
It's beyond
right.
beyond your realm of expertise.
Why are some dicks bent? And can bend back?
Yeah.
Oh,
Angular.
Wow, this guy's full of good questions.
Yeah. really. Penis is his expertise.
The two commonest reasons, one is what we call a congenital curvature, born like that.
Okay.
The other is Peyronie disease. There's this fibrous tissue inside the shaft. For whatever reasons, it can get inflamed. Right? So when it gets inflamed, then it forms a scar.
Oh.
The scar is unable to stretch. So can you imagine if the scar is on this side? So this side stretches, this side cannot stretch. It will.
You will move towards that direction.
Yeah.
So a bent dick is not normal.
If it's congenital curvature, then it's considered normal lah. The worst case I've seen for Peyronie's, right? It was literally a 90-degree.
No lah.
Stop it lah.
As in like this.
Then you
90
just throw
degree
it and it
bend.
comes back.
So the guy has to face away from his partner to have sex.
And he has to do
And do
this.
sideways.
Only half can go in.
No, unless he going sideways, then he turn.
No, because it'll be like this.
I think it'll be rather uncomfortable for the partner.
Oh wait, you cannot just bend it back.
The plaque is there lah. So the only established treatment for Peyronie's disease is actually surgery. That said, a lot of patients don't want surgery. We do get other treatment options. The shockwave therapy, there's
To kind of break up
pills.
the hardened parts. Okay.
But none of these are proven therapies, you see. So all this is try and let's hope it works kind of therapy.
Have you had to do it?
Yes. And to be fair, there are some patients it works quite well.
Oh.
Wow.
Yeah.
Okay.
To be fair,
That's
right.
nice.
Then I mean, speaking of bend, so like that's like left or right? But then guys' penises also, there's ones that go like this, there's some that go like this.
So for congenital curvature is usually left-right. For Peyronie's disease is usually up.
Wow.
Yeah.
So if your dick is bending upwards, maybe go and get checked lah. Okay,
Is
wow.
Is it because they tuck wrongly? Like they keep their penis in the underwear wrongly also?
No.
Oh.
Not at least not that I know of.
Because I always confuse like
Yeah,
when
yeah.
a guy, how a guy keep his dick, like is it left, right, up or down?
Yeah. My whole life has always been down. And so it bends that way.
We don't recommend that you fold it. You can keep it down, up, left, right, but don't fold it.
Don't bend into half.
Don't bend it.
Wow, it's showing off, yeah.
Oh.
Because you can traumatize the urethra, you can traumatize the urine tube.
Okay.
Oh.
No, because I'm reminded by this scene in Superbad where he's like, if you have a boner, right, tuck it in the bend of the underwear. Because it keeps it concealed.
Oh, sure.
Okay, besides getting hard as a problem, I think the other problem that a lot of guys face is also lasting longer. Is that something that patients come to you for? And how can someone actually last longer?
Okay, premature ejaculation. What's the definition of PE? Last time it used to be 1 minute, right?
So long?
Okay. But after a while, we realized that that's not a really good definition, right? Because what you're saying is, if somebody can last 59 seconds, he got problem. If you can last 61 seconds, you don't have problem. It's silly, right?
Yeah.
So now the definition has changed slightly into it's about control and distress, right? So number one, you need to have control. You need to decide when you want to ejaculate and when you don't want to ejaculate. And then distress. If it's causing the patient distress, causing the partner distress.
Yeah. Okay.
Right? Yeah, because I don't know, I guess maybe some partners want it fast. Now, then we divide PE into two types. One we call lifelong PE, one we call secondary PE. So lifelong PE means born like that. Has always been like that.
I see.
Okay? I tell patients this is not a disease. You don't have to treat it. Right? It's actually a survival advantage.
In the cave, right, the lions can hear you having sex, so you gotta ejaculate first.
Oh, exactly.
No, are you serious?
Yeah. No, the point of sex is to propagate
Procreate, yeah.
right?
Fast.
So you just want to ejaculate, get her pregnant and get out of there. Okay, that came out wrong. You must
Get in and get out. Well, ma'am, thank you, ma'am. Yeah.
respect and love her at the same time.
Oh, right.
Now, secondary PE, that means, hey, doctor, all my life, no problem. No. Then past 2 years, wow,
Oh.
suddenly cannot control.
Come so quick.
Then we have to look for a underlying problem. The commonest problem is what we call an occult ED. So they actually are getting
that's
erection problems already, but they don't know. The body knows. So the body adapts by ejaculating faster. The body knows I'm going to lose my erection. I better ejaculate so that I can get the next generation going.
Oh, it's so adaptive.
The body.
What about the opposite? Like you last too long. Like you cannot come.
Wow, that is... Wow, this guy.
有没有?
This guy.
Not a problem that he faces, but yeah.
I represent all men today.
I have had patients like that, right? Until they're literally sweating, their partner's complaining, they just can't. Okay, that's what we call an ejaculation. Unfortunately, right, not many treatments for that. Because honestly, society doesn't see that as a problem. Right? Medicine doesn't see that as a problem.
So then no drug company is like willing to like create a fix for it.
That's so sad though. That's so sad.
Yeah.
There's
No, I agree. Because there's no solution we can give the patient.
Yeah.
I remember like going through so many different like mental exercises to try and last longer. Like I would like just like while I'm doing it, right, like do my finances. Like I was start thinking of the budget.
Wow.
Then for a period of time it was like old people like fighting. Then old people fighting naked.
Okay.
Like would do it for me. But then you also don't want to last longer and then lose your erection.
Right.
So old people fighting naked also made me lose my erection, which was a problem.
So what are you thinking of these days? Let's go.
No, I was hoping to offer that. So in case any of you want to share your own methods of lasting longer.
Are there actual methods?
These guys, yum.
Are there actual methods? There are several, but all of them don't really have good data, right? I guess the popular method is start, stop,
What's start, stop?
So start and then like, cramp.
and then go and do something else,
Okay, then start again.
Then start again.
I think
Like pause.
Yes,
it's whether how willing are you to share that with your partner so that your partner knows, or you try and pretend and conceal. So you say like, wait sorry, neck ache. And then like go and try something else. If not, if your partner knows, then you like, okay guys, pause.
Yeah.
Pause and go bush diving.
Cunnilingus. That's what you mean. Yes. Why am I understanding all?
Okay, a question that I have, right? From your perspective, is masturbation like good or bad? Like, are there times when it's good, are there times when it's bad?
Oh, that is interesting. So there's this study that media really picked up on that was quite hilarious is masturbation has been associated with a decreased risk of prostate cancer. There's really no good or bad to masturbation. Right? It's a very natural thing. A lot of people like to blame a lot of sexual dysfunction on masturbation.
Yeah.
And honestly, there's no link. The problem with masturbation, again, it links back to mental health. So if a person grows up like masturbating in secrecy, in the bedroom, scared the parents will come in, that might lead to problems in the future.
Like what? Then you should welcome your parents, man. It's confusing as
Hey guys, go to masturbate. No, but what you're saying is that their relationship with sex might be maybe a little bit associated with like taboo.
Yeah, anxiety, right? Yeah, quick ejaculation.
Okay,
yeah,
okay.
Something shameful.
Okay.
Mm,
Is there like a healthy frequency?
Again, it's a mental health issue. If people are using masturbation as, let's say, a technique to manage their anxiety,
Yeah.
right? Then of course, that's no good,
Oh, okay.
right?
Damn
Yeah.
it.
If a guy doesn't have sex or doesn't masturbate, right? And then that means he doesn't come at all.
He will
Huh?
in the middle of the night.
Oh, that's
it
what
will
wet
just
dreams
come
are.
out.
Yeah, that's what the body does naturally.
Because I'm thinking like, what if
Yeah.
you don't have sex or don't come? Then your body just build up all this sperm.
Yeah.
So why do we have wet dreams lah?
Yeah, your body would automatically, empty the warehouse.
So, but if you keep emptying your sperm, right?
Mhm.
Like you just keep masturbating all the time. Does it affect like how your body produces the sperm? Like, does it train your body to like produce more?
No, but if you ejaculate very, very often, the motility of the sperm may drop.
Okay, so this is what I want to
Yeah.
get into because
Yeah.
I think beyond ED and penile enlargement, like the most serious topic is infertility. I think it's something that is happening. It's prevalent. Our replacement rate isn't great. Does masturbating too much affect sperm quality?
No,
So it's like unlimited bullets.
unlimited bullets. Yeah.
Respect.
Okay, so then if, say for example, someone has ejaculated multiple times in a day, like he masturbated in the morning and now he's going to have sex with his wife like maybe 2 hours later, does the amount of sperm change?
The volume of semen might be different,
Okay.
right? But the concentration of sperm should be the same.
Oh.
Yeah.
That's crazy.
The motility may be a bit less. Yeah.
So they swim a bit slower.
But it's fine, In fact, there was one
Sluggish.
study long time ago, I think from Italy, that actually recommended twice a day intercourse to increase chances of conception.
Clever guy.
Wow.
His wife wasn't giving him it. Okay. Shark.
Yeah. No, but I agree with you. If you look at the worldwide stats, sperm counts have dropped by about 50% in the past 50 years.
50?
50%.
If this is so widespread, is there like a problem? Is it the diet? Is it using phones? Like what's
Your guess is as good as mine, man. There are a lot of theories.
okay?
Right? Yeah, our diet, processed food, more maybe hormones used in farming, phone use, whatever. Like I don't think anybody knows for sure.
Because I
But
know
50%, is it an actual problem?
We're definitely seeing a lot more male subfertility cases.
Yeah.
Right? Maybe it's one of the reasons why our replacement rate is so low. Right? So is there a reason to be alarmed? Yeah, I guess so.
when we talk about infertility, is it low sperm count or is it lots of sperm but just damaged sperm?
When we do fertility assessment for guys, we do a sperm analysis.
Okay.
Okay, we don't actually measure their fertility, right?
Yep,
This is a surrogate marker for fertility. Okay, so we look at concentration. Then we per mil of semen, how many sperm there are, total number of sperm, how many there are, how many are live, how many swim fast, how many have normal size and shape, all these things. How do we come up with these numbers to say this is normal? Right. So the WHO went around the world, collected semen samples from men who managed to get their partners pregnant within 12 months. Okay. You will note in this study that Asian countries are not very well represented.
Okay.
So this is mostly Western.
So they came out with these numbers and say, okay lah, if it falls into this range, it should be okay.
Okay.
Right? So does it mean if it's in this range, the guy is 100% fertile? No. Does it mean it's under this range, the guy is definitely infertile? Also no.
Right.
So for doctors, we will look for markers of serious problems. So for example, if their concentration is less than 5 million, then we'll be thinking along the lines of, oh no, is the tube blocked? Is something wrong with the testes? Yeah, is something wrong with the hormones? Things like that.
Because I'm guessing when a patient comes to you or a client comes to you, they already have that problem. They've been trying and they're not getting pregnant.
Yes, but there are also people who come and say, we haven't even started trying, but we want to make sure everything's okay first.
Preemptively lah. Got it. Is there an optimal volume of load per ejaculation?
Volume,
Yeah.
above 1.5 mils.
Above 1.5. So below, then you should be concerned, go and see a doctor.
There's no magic to this 1.5 mil number.
Yeah.
Right? Below could very well still be normal.
Is there a danger on the upper end? Like, oh, I cannot stop coming.
So,
Like so much. It's like, goddamn, somebody bring another towel, you know what I mean?
yeah, no end ejaculation.
Well played.
So if it's huge volume, then we also want to be concerned about things like inflammation. Is there inflammation of the ejaculation system, the seminal vesicles? Is there a kind of infection going on?
There was a myth that was going on in Reddit. I wanted to get your thoughts on it. Is it true that older sperm has a higher chance of producing kids with like mental health problems or schizophrenia?
Wow, I don't know. So all these things that we do, right, is to look at the likelihood of conception, right? We don't look at the quality, so-called, of the conception.
I see. Okay.
Even things like more advanced sperm tests, like what's known as a DNA fragmentation index, right? How broken the DNA is in the sperm. It really doesn't predict how normal the baby is going to be. Yeah.
So there's this thing where like women have a biological time clock, whereas guys don't really have that. Is that true, or is there a certain age where guys get where really the sperm quality is just not good enough?
No, that's true.
Wow.
That's true. Sure, you have heard of guys in the 70s still having kids.
Yeah, Robert De Niro just had a baby.
What?
Yeah. Wild, right?
Robert the hero, man. Respect. Having a kid at 70 is crazy.
No, like to have just the mental fortitude and like stamina to like have sex and then have the child
Sure.
is wild.
My hero.
I do want to get into men's health, right? And I think there is still some form of social shame, or you mentioned about guilt as well. Do men, in your opinion, still struggle to seek help?
Definitely more open than 20 years ago. You do still see guys come in very hesitant, but the fact is they've already mustered the courage to actually come in. That's a massive step already. A lot of this are for infection cases. Then there are also cases where it's the partner that brings the guy in.
So the wife and girlfriend calls you and makes the appointment.
And most of the time, these are for what kind of issues?
Erection issues, fertility issues. I would say from a sexual health standpoint, perhaps the awareness has increased over time. Also, I think people are a lot more willing to come forward. For example, HIV screening, right? Which is part of sexual health. Right now, we've come to a point where you can even get self-test HIV kits from certain pharmacies. Just buy over the counter.
Yeah.
And from our last conversation, I think you mentioned that you want the first to actually have this anonymous
This
testing.
anonymous HIV testing, yeah. So I think that those are great policies. Will come a long way.
I think the awareness is one thing, like you mentioned, why people are coming forward. And something that we mentioned before is ED. I think we saw a study that more Singaporeans in their 30s are actually getting erectile dysfunction, which was quite surprising to me because I thought it was like an older men problem. Is there a reason why more younger men are getting ED?
I'm not sure if there's an actual increase in the number of younger men getting ED.
I see.
Right?
Okay.
The age of the patient kind of influences our differential diagnosis, right? If an older man comes in with, let's say, diabetes, high blood pressure, automatically I'll be leaning towards maybe his blood vessels are not very healthy.
Okay.
If a younger man comes in, non-smoker, no chronic disease, then I wouldn't really be thinking of his blood vessels, right? A lot of people like to blame psychological causes.
Mental health. Okay.
Mental health. We shouldn't make this kind of diagnosis too easily. We should try to exclude everything else first, unless the history is very obvious. So one of the commonest things I see, right, is trying for conception.
So the stress of trying to get your partner pregnant.
Yeah. So everything okay, until suddenly the partner says, hey, I want baby. Right? I did my test. Tonight must. Fertile must.
Right. Performance anxiety.
Performance becomes an issue.
So it's very real.
What we do to help these patients is we actually give them tablets. So we physically make the blood vessels easier to dilate. So they need less stimulation to get and maintain an erection.
Like Tongkat Ali, this kind of thing.
Not Tongkat Ali.
Wait, does Tongkat Ali actually work?
Tongkat Ali actually work. So there are some small scale studies to show Tongkat Ali increases testosterone production.
Testosterone production.
Production.
Okay.
Yes.
But
Yes.
that's different than what you're talking about with regards to the blood vessels.
That one very different.
Okay,
Yes,
okay.
yes.
Okay.
For younger people, the other thing we look for is phimosis.
What's phimosis?
Cannot pull back the foreskin.
Oh, so for those who are not circumcised.
For those who are not circumcised, some guys, they have no idea you can pull back the foreskin. So for 20, 30 years, the head has been covered.
Oh my god, that was me.
Oh.
Like
I mean, like, but when I was like 11 or 12 or whatever, right?
Right.
Like, I never knew until one day I was peeing or what, right? Then suddenly I pulled it, like, there was a weird feeling. Then I pulled back a bit more, then pop.
Oh.
Then it's like, what the? There's more.
A lot more.
Yeah, it's like crazy. Like, and nobody tells you that.
Yeah.
That's the problem.
So imagine 20, 30 years, the head has been protected, covered, right? Suddenly, it has to do a job, right?
Yeah.
So it's actually very sensitive. So they can get erection, no problem. Then the moment they try to penetrate, the head hits the opening, right? And it's so sensitive, it's actually uncomfortable. So what happens when there's pain? The erection goes away,
Yeah.
right?
Yeah.
For these kind of patients, it's usually very easy. If the foreskin is loose and they can pull it down, we encourage them to pull it down. Every time you go to the shower, you pull it down. So it desensitizes over time.
Right.
I tell them it's like walking bare feet. First few times you walk, ow. After a few times, no problem already. Okay? But of course, if the foreskin is so tight, it can't come down, then you'll end up with circumcision.
So someone could get a circumcision when they're 30, for example.
The oldest patient we have circumcised is 73.
Respect. Why? Just curious.
Diabetes, foreskin infection, fungal.
I regret asking. So they live their whole life with that? Or is it something that can develop later in life?
Oh, that's a very good question. So yes, there's such thing as secondary phimosis. Two common conditions. One is recurrent infection, so usually associated diabetes and diabetes medication. The other is this chronic inflammation of the foreskin called BXO. Where we don't really know what causes it.
Right.
But over time, the foreskin just gets thicker and tighter.
Right.
Mm,
So then most of these, the procedure is circumcision.
Yeah, have to.
Okay. Wow.
So you talked about how, right, when someone has foreskin and never pulled it down, like it becomes extra sensitive. Does a circumcised penis become less sensitive?
Overall, the studies I've read, circumcision seems to improve sexual performance rather than make it worse.
So it does reduce sensitivity in some ways.
I guess so.
Okay.
Yeah.
So circumcised.
If you want to up your game, break some records.
Yeah. There was some discussion, especially in particular in Singapore, where a lot of people felt that the Singapore education system focuses on abstinence rather than safe sex, and that then creates this very awkward relationship that people have with sex. Do you think that that's the case?
Wow, that's a minefield.
It is a
man.
minefield, and we wanted to throw that minefield at you. We waited 1.5 hours.
That is a minefield. I probably think they are preaching abstinence not so much from a fertility point of view, but more from a infection and don't get yourself into trouble when you're too young point of view.
So speaking of that, like what is the most common, I guess, like STD?
Chlamydia, gonorrhea, herpes.
Is that common in Singapore and globally per se, or is it just widely?
Chlamydia is extremely common.
No, I remember like we had to cut this out from the previous episode, but you spoke about like I think a patient who was not pleased about his HIV results.
I won't mention the country. Overseas guy came to Singapore for work, recently married, but his wife went on a trip, so he decided to, have some fun. Came to Singapore, wanted to do a HIV test, just not expecting anything, just to clear his mind. But unfortunately, it turned out to be positive.
How do you navigate that?
Okay, so we're always taught to deliver bad news in the most straightforward and simple way. You don't try to cover it, you don't try to make it sound any worse or any better, right? You just be very factual. Your HIV test is positive.
Because you can learn in theory, but then to be actually in the situation of delivering bad news, like
it's quite scary. The first time where I actually saw, because when you're running the rapid HIV test, right, you can actually see the red reagent run up the strip. You can actually see the positive line coming up, like COVID ART like that, right? I saw the positive line developing. There's this sinking feeling, because you're going to have a very difficult conversation, but no choice.
What tends to be the usual reaction? Is it anger? Is it disbelief? Is it denial?
Maybe people with more awareness, more education, and also knowing people around them who have dealt with the disease. There's not so much unknown. So they handle it a lot better.
And I think with a lot more like awareness now, I think we've done a couple of campaigns. So like it's not the end of the road essentially if you have HIV. There are options, there are avenues for you to live a somewhat normal life.
So the very unfortunate thing is, it's a social stigma issue, right? It's not a medical issue. Medically, we can control it very well and very easily. But the social stigma for HIV is so great. I remember diagnosing this patient, and that time I was still young, so I made the huge boo-boo. Okay? I feel shy even saying this. So I said this horrible term, which is, hey, look, at least it's not cancer. Okay, yeah, shoot me. Honestly, I really regret saying that. But then the patient stared at me and went, I wish I had cancer.
Damn.
Then it really sunk in, how bad the stigma is.
Like year on year, like whenever we also do it and also we see the campaigns, we are still like, at least for me, right, I'm also reminded again, oh yeah, wait a minute, it is a social stigma. I forget, I default back to like, whoa, it's a terrible thing to get. Which I mean, it is bad, it's just, it's associated so much with the stigma more than the actual medical issue.
Yeah, I really feel like this is such a good thing that you brought up.
Yeah.
Because it really helps to put things in perspective.
Exactly.
So first, I want to clear a misconception.
Okay.
A lot of guys do come in for infections in the genital region. I think the misconception is any infection in genital region has to be sexually transmitted.
Oh, yeah.
That's not true, right?
It could be UTI, for example.
Well, the commonest infection we see is actually foreskin infection. And what causes foreskin fungal infections is diabetes. Certain medicines used to treat diabetes. Hygiene issues. When I say hygiene issues, I mean too hygienic, not hygienic enough. Right? Yeah.
Like they overwash it.
Yeah.
Oh.
So imagine you see something funky down there. What's the normal thing for most guys to do? Say, I'm a bit dirty, I clean more. I clean, I use Dettol, I clean. Then what does it do? Dettol traumatizes the skin, strips away skin oils, it kills away the healthy bacteria. Right? And then the infection gets worse. Very much like why we tell women don't wash internally.
Oh.
Because it messes up the balance,
Right. The pH balance especially.
Yes, the pH balance, right?
Yeah.
What I call the microenvironment.
Yeah, exactly.
Wait, so is there dick soaps?
Oh, good question.
There
Because there's
is.
vagina area soaps, ma.
So I tell my patient, you need to get a gentle soap-free cleanser. And I tell my patients, actually, just go and borrow your girlfriend's intimate cleanser.
Oh.
It's the same thing.
So guys should essentially use intimate cleanser, especially if they feel like something's too dirty.
Use a gentle cleanser, or sometimes you don't really need to use soap.
There's something that someone asked, like whether is it an old wives' tale or is it real? I don't know which old wife is telling this. But do I need to pee after ejaculation to reduce the likelihood of infection?
That's for women.
Oh.
Also for women, yes.
We tell women to pee after sex is because during sex, bacteria is pushed up into the bladder.
Okay. So that's to prevent UTI.
You guys to prevent UTI.
But for men, hold it in.
Okay, you don't have to.
Okay, we have another question. Is, are blue balls legit?
Ooh.
Let's say I'm turned on, but then I never finish. Then I start to feel pain.
Pain?
Yeah.
I've not come across that, man.
I heard, right, it's a lie.
It's just the guy really want to
Yeah,
have sex.
I think all guys, right, they lie about this, right, so that they have an excuse and the girl will feel bad and like help them.
Okay.
He don't want to be the guy.
Yeah.
Hey, respect, man, respect. From his expression, but he never. Okay, then another one. This is okay, this is for Raja.
Okay.
Is there anything people think they can use as lube but actually cannot?
Like essential oils.
Yeah, don't use essential oils. Don't use water. Don't use.
Water? Why?
Because it gets squeaky.
What?
I would think water is the safest one.
It's actually not a good lubricant. No, people who have had
Oh.
tried to have sex like in a hot tub or in a bath, it actually makes it quite difficult.
Oh.
There are two big groups of lubes, right? There's water-based lubes and then there's silicone-based lubes. So the water-based lubes are the very common ones you find everywhere in the pharmacy.
Right.
The problem with water-based lubes is after a while it dries up. Water-based right? The silicone lubes will never dry up and they're super, super slippery.
Slip,
So no, but
sliding.
so if you're gonna use the silicone one,
Well, I mean, these are the two options. I'm not saying that water lubes are bad, but you just have to know that they dry after a while.
got it.
Top
What
up,
about,
top up,
is
okay.
saliva safe?
Is saliva safe to use as a lube?
I don't know, I will see people just, I got see people like they spit.
Yeah.
I'll say in the course of events, saliva will come into contact with the genitals on both parties.
Okay, no. So there is a question, right, that we came up with, right, which is that, okay, the penis is a magical thing, right? So sometimes it just randomly gets erections, and sometimes in awkward situations, and you need to get rid of that erection fast.
Yeah.
So a method that I've seen online is that you quickly wiggle your toes,
Oh.
and then it will help to get rid of the erection or whatever, right? Is that a real method?
I've honestly not heard of the wiggling toe method. Yeah.
Neither have I.
Yeah. But I guess it can be socially awkward, but from a health point of view, there's really nothing wrong with it. I think it's great.
So just walk around with a heart on.
Congratulations.
Yeah.
But it's not weird, very like you suddenly talk to someone that's
You got own it.
Bro, but if,
don't mind this.
Yeah, but if I'm like if I'm like a teacher at kindergarten, you know,
Wow.
No.
Let's not go there.
That's the thing. Like my secondary school
how?
teacher, right? You can always tell because he will always like lean forward. He will never stand
Yeah.
up. Like he will just be like he will read his book like this way.
Oh, okay, there are very extreme ways. There's, chemical castration. So we give medicine to,
Oh.
to
That sounds
reduce
like-
hormonal
That
levels.
sounds like torture.
It's extreme. No way we're going to give it to regular Joes. No
Also,
way.
in what situation will you use chemical castration?
It's been talked of as a treatment for repeat sexual offenders.
Wow.
Oh, in Singapore?
Yo. Yes.
Okay. That sounds about
Cut
right.
that dick off.
Yeah.
Yes.
No, they don't
this
actually.
Oh,
They don't
I
actually.
mean-
Worse than that. Yeah.
So interesting.
Yeah.
And is it reversible?
It's reversible.
Yo!
Boo.
Right.
This is a huge deterrent, I think, I hope.
Well, we,
Yeah.
we basically give a medication to suppress the hormonal levels to a point where hopefully there's zero sex drive.
So it's not even like if I am a previous offender and I come out and then I want to offend again, but I cannot use it. It's I don't have the desire or
Yeah, yeah.
drive to.
Yeah.
We have fixed them.
What? So what are the ethical issues behind this?
I have no idea. You got to ask the policymakers.
Okay.
Yeah.
You know, we were talking earlier about like foods you can eat to get a hard on, right? Are there any foods that can cause like
Flaccid.
Not that, no. I do know that soy products contain a lot of phytoestrogens,
which
which is a female hormone.
okay.
So I've had cases where guys, they drink, like this patient who would drink 2 cups of soybean milk every single day.
Wow, that's a lot.
Yeah. Then he started getting man boobs.
Oh.
Okay.
Solution is to stop.
Yeah, so they should stop. Yeah. Yeah.
But if you want to grow your chest,
And then the man boobs go away? Or you got to work them off?
You hope it goes away, but if it doesn't, there are treatments.
Damn.
Yeah.
Oh,
Yeah.
okay. Interesting that you bring this up because, right, I've heard of men being able to lactate. Is that true?
what?
That's a problem. So all guys, actually, we have breast tissue, right? It's just very, very little.
Okay.
So there has to be a hormone that will make the breast tissue grow and become active. And this hormone is called prolactin.
So we have like the mammary glands and everything to produce.
We have breast tissue, yeah. It's just very, very little.
So they can make
Yeah.
milk.
They can.
Yeah,
So if you suck long enough, it just
No, so
spills.
that prolactin thing is something that we can like increase.
So if there's a tumor in the brain that's secreting a lot of prolactin, then it can cause these problems. Yeah. So you know guys can get breast cancer, right?
Yeah.
Yeah.
I know it's not a technical term, but like if someone has man boobs, is that a problem that they can come to you for as well?
So
yeah.
the technical term is gynecomastia.
Oops.
Yes,
Okay.
we can look into it. So usually we see if there's some kind of a
Imbalance.
hormonal imbalance, right? Or sometimes it's just anatomical like that. So those will require surgery.
Why do we get morning wood?
Oh, morning wood is actually not morning wood. Morning wood is a leftover night wood.
What does that mean?
What
That
does
means
that
you
mean?
fell asleep with an erection.
Okay. So throughout the night, the penis needs fresh blood, right? If not, the tissue will become unhealthy.
Never knew that. Okay, so it's like vampiric in nature. Okay.
Throughout the night, physiologically, the body would pump fresh blood into the penis. You get erection, it comes down. You get erection, it comes down. So that's what we call nocturnal tumescence. Okay? So if you wake up while you have a nocturnal tumescence, you go, oh, morning wood.
So you take a time lapse of a guy in the night. The thing is just
One test that is rarely done these days, but we used to do, is we actually put a pressure transducer ring around the penis, let him go to sleep, and then you can see the pressure reading throughout the night. It goes up and down, up and down. One.
Oh,
Yeah.
wait, I've heard of this.
Yeah.
So we had this guest on called Brian Johnson. Then
Okay,
he's
yeah.
like trying to reverse aging and that kind of stuff, right? And one of the things that he was talking about was how he measures his erections at night. And apparently like the longer you have, the duration of erections you have at night, it's actually an indication of how healthy you are.
Good blood flow. Yeah. That's why I said
Which is exactly what you were saying. lah.
sexual health is a barometer of
Yeah.
overall health. Yeah. Yeah. So I even know of this pressure transducer ring, Bluetooth one, no. Bluetooth to your phone.
This is the thing is that Apple Watch, right, can like measure so many things, including women's health, right? There's no emphasis on men's
Yeah.
health.
Where's the iDick?
Oh, that's crazy. That's crazy. And do you want to build this together?
Before we had these kind of fancy devices, how we used to measure nocturnal tumescence, right, is we use stems. Last time, stems comes in a strip of 5-6 stems with serrated edges. You paste the stem around the penis.
Wait, like mailing stems.
Like mailing stems.
Oh.
Stems.
Like
Okay.
And then if tomorrow morning the thing is ripped, that means you know you had a nighttime erection.
Or really some
The way we
low-tech
used to
way.
do it, that's super low tech.
So would it actually be beneficial to me to, let's say, film myself sleeping naked for one night, right? And then just see like the total duration of the
Be
erection.
careful who you send it to.
Like, is that helpful?
Hey, can you try?
Yeah, I'm thinking of doing that. Or where can I buy that ring? I don't know.
Which website? Which website you gonna put it on? These days, we're moving away from nocturnal erections.
Okay.
So what we do is we put the patient in a private room, we put the pressure transducer rings, okay? And then we put VR goggles.
What?
Yep. You know where this is headed, right?
On?
Yeah.
So
What-
simulate sex and then...
It can't just be a video, it needs to be VR.
Maybe the VR goggle is just for his privacy. You have a 32-inch screen.
Fair enough. Okay.
Right, yeah, and then we see the erection response.
Okay.
Oh.
Yeah.
Do Kegel exercises work for people with ED?
Wow. So I want to give a shout out to the male pelvic floor physiotherapists in Singapore. I know personally 2 of them and they're doing great work. So the female pelvic floor has gotten a lot of attention, right? Because after birth, it gets loose, they do Kegels, tighten it up, all that. The male pelvic floor, unfortunately, hasn't gotten the same attention.
Yeah, what's up with that?
Right? And the male pelvic floor can cause problems also. And usually it's the reverse of the female pelvic floor problem. So female pelvic floor too loose, male pelvic floor too tight.
Oh.
So Kegels can actually make it worse. So before you jump in and start doing Kegels, please see a doctor. You may even want to see one of these male pelvic floor physiotherapists, do an assessment of pelvic floor, tell you whether it's too tight or too loose, and then prescribe you the correct exercises to do.
What's the consequences of it being too tight? What does it actually result in?
Oh,
Like
it can
ED
cause,
or-
ED problems, PE problems. It can cause anal fissures. So the pelvic floor is a sheet of muscle that has to hold up kilos of internal organs, right? Because
Okay.
your pelvis is a donut, right? There's no floor.
Uh,
So if there's nothing there, your organs will just drop to the floor.
damn, never thought of it that way.
Right? So there's
Okay.
this sheet of muscle there that's holding kilos of organs up.
Yeah.
Okay? Not only that, this sheet of muscle has to have at minimum 2 openings. Right? So one is for urine to come out, one is for stool to come out.
Okay.
So this thing has to hold up kilos plus relax this opening so that stool can come out. So the fella confused. If you want me to be tight or you want me to be loose, right?
I see. So Kegel tightens it up.
Yes.
And
So-
if it's already tight, then why are you tightening up?
Yes.
Girls.
It's like when you try to close your butthole.
Also,
doing it right now.
so if now I squeeze,
5
is it called Kegels?
Yes.
To a rhythm.
Yes.
So
Yeah.
Kegels is not
We will
good.
rock you.
No, so Kegel for women is usually very good. Yeah.
I'm so sorry. I'm reading what you
Why?
you just sent me. And he's like, wait, so it's bad to be curling with your penis? I heard that people tie small weights to the end and do Kegel.
No, so this was a thing in secondary school.
What do you mean?
Like we would put textbooks on our dicks. Then we would just sit in class and then we would just like lift weights with it.
Ew.
Wow.
Bad, good, neutral.
I don't know.
I think it works. Then another one. The difference between ejaculation and orgasm.
Wow, that's a good question.
Of the ice.
That's a good question. I would think ejaculation refers to the anatomical shooting out of the semen lah. Where orgasm is more holistic, right? They get that dopamine release, the sensation of pleasure, right? And then the spasmodic contraction of the muscles. So if you stimulate ejaculation, let's say I put electrodes on the muscle, and this has been done, and I turn it on, then the electrodes cause the muscle to squeeze, the guy ejaculate. I wouldn't consider that orgasm.
Like he won't feel anything.
He's not happy.
There was the craziest penis you've ever seen.
Off the top of my head, I can't think of anything. I guess we've seen so much. Everything is kind of routine already.
But like the smell so strong, your mask don't help at all. Like
The worst thing I've ever smelled was a retained tampon. So the lady completely forgot she put one.
She forgot she put one.
Then she put a second one. Then after a while, she started getting a rash and then this horrible discharge. Then she was like, what's going on?
Early days, I'm guessing.
Yeah. So that one, jokes aside, is super dangerous because it can cause sepsis.
Yeah.
So no leh. I mean, I've not had a bad smelling penis before. But I guess I don't put my face so close and then I can smell it.
But you have to get quite
You have
close,
to-
right? Like if there's like...
Well, dude, we use an examination lamp.
Oh.
So we have a lamp with a magnifier and then lights at the bottom. Yeah, so there's always this between my face and
I
the
thought
patient.
that you would be right in it. Okay.
Oh, like dentist.
It's just a big magnifying glass with lights at the side, and then we can choose a white light or yellow light.
Oh.
Are guys offended when you pull out the giant rectangle?
Some laugh, some like yeah, some
Where is
funny.
it?
Yeah. I said, oh, dog, you need that. I said, no, my eyesight poor.
Good save.
A question for the lady viewers out there. Ladies. What is the most sensitive spot on the penis?
The glands, so the head, and then especially the frenulum, which is that little strip of skin just under the head.
Yes, right.
Yeah.
How about the like the dick, right? Then you say before the below
Yeah. Like between the balls and the anus.
Yeah.
Oh, the ABC, the ass balls connection.
Yeah.
ABC soup.
Which is technically called the perineum.
The
I don't know. I guess some guys like being stimulated there.
Oh.
Yeah, because apparently like touching there or like pressing there is pressing the prostate a little bit.
The prostate is just deep to that area, yes. The best way to stimulate the prostate is actually through the rectum.
So finger in.
Finger in. You can actually make a guy ejaculate by fingering the prostate.
Oh.
Cool.
Interesting that from like a medical point of view that is it recommended? I mean, not say recommended lah, but there's no problem with
It's recognized.
putting things up.
They're not dangerous. No, they're big dangers and risks.
Oh, they are?
Oh.
Like what?
When I was a very junior doctor and I was in SGHA&E, this lady came with a perforated rectum, because the boyfriend shoved something up. And actually
my God.
broke through the
Jeez.
large intestines. I had patients who lost dildos up there.
This is why you need the end. Like butt plugs have the end so that it doesn't go all the way in. Yeah.
Yeah.
Oh, so you just stuck there and then they go A&E.
They have to
Most
lie
of the
belly down on
time
the back
lah.
seat.
Most of the time.
the way there.
Oh shit.
Because if we put it under sedation, then everything can relax. We can pull it out.
Right.
Oh.
Do you return it or like throw it away?
No, we return it lah. Maybe expensive.
Maybe expensive, bro. Traumatizing, I would say true. No, so the question is frequently for sexual activity or any other purposes, right? It's not medically not recommended lah, because it involves a lot of risk lah, right?
Just like everything, if the people involved know what they're doing and they're careful, then it's not an issue.
Everything in moderation.
So like some guys like to go for professional prostate massage, but non-doctors, right? 抓根啊.
It's Hokkien.
We Matt did it before, right?
In
For
Singapore?
for the MYG video.
No, there was a penis massage.
Oh.
But this is a prostate massage, which is
yeah.
up the rectum.
And then,
Oh.
to ejaculate.
Some of them do, some of them don't. I mean, they claim there's health benefits. I can't say there's any medical literature to back that
Right.
up. So when they ask me, should I do this or should I not do this? My answer is, well, you gotta make sure that the person doing it for you knows what he or she is doing lah. Because I have also seen situations where they just fumble up there and then they cause inflammation or injury and things like that. Yeah. So obviously when doctors put something up the anus, it's for a particular medical purpose, right? We're
Yeah,
doing
for
a
sure, for
scope,
sure, yeah.
we're examining your prostate.
I think another thing is that to demystify this, because I think some people are usually scared. Like there's this stigma among guys like, oh, I've got to, go for a colonoscopy or whatnot. What actually happens when a doctor puts a finger up? Like what are you looking out for and what is there to expect?
We know what we're going to look for even before we do it, right?
Okay.
So what am I doing for? Am I looking for the size of the prostate? Am I seeing if it's painful, it's tender? Am I looking for a trigger point? That means a tightness in the muscle. We're not just going up there blind and then see what we find.
Yeah.
Yeah.
But I think a lot of people don't know it because a lot of them have never had a finger up
Yeah.
their
And what
their
happens? Like,
rectum
is
before.
it you just go in then go out? Oh,
So what you-
what happens?
Might as well don't do
No, I thought you just seeing how tight the thing
Express car
goes.
wash.
Oh, like the
around.
dilation.
So first of all, You make sure that the patient is comfortable.
Okay.
Are they on their fours, all fours?
No, they are lying on the side.
I see, okay.
Oh.
Right? You make sure you have your gloves on.
Okay.
You make sure you have adequate lubricant.
Okay, why?
Okay. And then what you do is you place downward pressure on the back of the anus first.
Do it showing it to the camera. Sorry.
near the tailbone. Right. So if the tailbone is here,
Yeah.
you press here first.
Okay.
So because it's a muscle sling like that, you see,
Yeah.
so when you press here, you relax this sling.
Oh.
And then you slowly slip it in. Because if you just jab like that,
Oh.
Who would do
They
that?
will contract.
Then your finger will
Contract.
squeeze.
the
Oh.
natural reaction is to contract. Then
Right.
you're going to cause damage. You're going
Right.
to cause breaking of the skin, right?
Oh.
So you relax it.
Wait, the balls is here.
No, the balls is here.
Opposite side.
Yeah.
Oh.
Relax it, then you
Is
slip it in.
it? Okay.
Okay?
Wait, so the prostate is on the back.
No, in front. So then you turn around.
The
Stab it and twist.
and then you feel
Dio stab
the
and twist.
prostate. Then if you're looking for trigger points, you 360 lah.
Wait, I didn't know it was so uncomfortable. I thought it was just in out like that.
It's definitely not pleasant. Actually, when you're pressing on the prostate, what happens is they feel like they really, really, really need to pee.
Oh, okay.
Yeah.
For a lot of Singaporean male, I think like sometimes they don't think about their health, not just genital health, but health in general. They think they're invincible. In your expertise, what is something that you hope they would start doing, at least for their sexual health, to look out for?
I think sexual health is a very good barometer for overall health. So if you find that your libido is dropping, you don't get erections, don't think of it as, oh, never mind lah, I'm at the age already, sex is not very important to me anymore, I don't want to do anything about it. No, this is an indication that something's wrong. No? ED is actually an indication that your blood vessels may be failing.
What?
Maybe getting blocked.
Dropping a bomb towards the end of this.
No, so look, if the penis blood vessels are getting blocked, that means the heart blood vessels are starting to get blocked also. Like, it's the same blood vessel.
Yeah.
Oh.
Right? So please, sexual health is a barometer for overall health. If you're getting sexual health problems, go and see your GP, go and see your doctor.
Now, like immediately.
Get it checked.
So would you say then that like for cases with like ED, alright, that if you improve your overall wellness, that might actually also improve your
Absolutely. Right? So
okay.
patients who are living with obesity, you lose weight, libido improves, erection improves.
Right.
Oh.
Right?
Okay.
Yeah, you do aerobic exercise, erection improves.
What about the opposite problem, which is like I just keep getting hard?
Then congratulations to you. Where do I send the bouquet?
You are the specimen of man. All right, guys, thank you so much for watching. And thank you, Dr. Tan, for indulging and lining all
Thank you,
our stupid
guys.
questions. Like, share, subscribe. We'll see you next one. Bye-bye. I just realized I might have inadvertently pegged myself before. Because I was taking a shit, right? And it was massive and it all couldn't come out in one go. So then when I let go, right, it went back up. And then it felt
Ouch.
like,
What do you
like not
mean?
bad.
Shut
It's,
up. It's just oversharing.
it's,
Nothing to do with this shit.
This is what this podcast has been for the last 5 years. What do you mean?
Oh, people naked
it's called
or
prairie
fighting.
dogging.
Why you know so?
What's that?
You know the hole in the floor, then the prairie dog.
What?
That's crazy.
You see the nature show, right? The fella from the brown color one.
Oh, the Pokemon.
The prairie dog. You look up prairie
The
dog. right?
Pokemon.
Unofficial term.
It's super unofficial.
This is what andrologists come together and laugh about and like joke about.